make small cuts of today's event so people be able to see it on the fly. So please go ahead. Sorry about interrupting you.
Okay,
What are your questions?
I'm talking about it's a cage and
Okay.
its beard. Okay,
And what?
and it's beard, SBIRT.
Okay. Okay.
Those two, both are for alcoholics. Uh, and its beer also can use for other drugs, substance abuse.
Mm-hmm.
And the thing is this: if an elderly patient, alcohol elderly patient, homeless, homeless, and you got both. You have cage and you have beer. So, I will. Is beer is the right option?
All right. So you are confusing. Okay. Let's clear this up. You have cage. Cage is for alcohol. What is SBRIT? That's
It's
not a
substance abuse.
that's not a scale, right? So the scale that you're thinking about, I imagine, let me see here my crystal ball. No, just kidding, is outed.
No, no, I don't audit, but I'm talking about if you see a patient, elderly patient, he's alcoholic but also homeless,
Okay.
homeless, and you have two A and B. You got cage or spear.
Okay. So let's talk SBRIT, spurts, right? So that's screen, brief intervention, referral, and treatment. That's not a scale.
Okay.
So what you do is the screen, brief intervention, referral, and treatment. So that would be more appropriate for this client. It is an evidence-based approach used to identify individuals who are at risk for or experiencing substance use problems. So the goal is to reduce and prevent related health consequences, diseases, accidents, and injuries, right? So in that person, because of that, is a homeless person. So you can do the screening, brief intervention. Here are your resources. I am going to place you for a referral, and we could start a treatment. When we start the treatment for for SBRIT, right? However you want to call the acronym, we use audit to measure how our intervention was beneficial or not. So they screen, right, asking the patients about their substance use patterns to identify the risks, potential risks. The brief intervention. For those identified at risk, a short conversation is held to increase their awareness for possible problems or harmful use of substance. Now, then we do the referral, refer the patient who needs intense treatment. They are referred to an appropriate service. So I think that question that you asked me about the homeless person with substance use, and one of the substance could be alcohol, right? You want to go above and beyond. You do a short treatment and do a referral would be probably the best option. Okay.
Okay.
Unless if the question there is more to it. Okay, because if you just do the audit, I mean the cage, you just identifying. And by the way, you need to know what cage is by the letter. Do not just kind of know, because if there are four options that starts with a C and they'll all look and sound familiar, you may be confused. So you need to know cage by the letter. You need to know that cage is positive if you have a score of 2+, right? It's only four questions. If you have two, then the person is at risk. All right. Hopefully this answer your question. If it not,
Yes.
please let me
Yes.
know.
Yes. It does. Yeah.
Okay. Gina, good evening. How are you? How can I help you today?
Good evening, sir. What is the best way to reach out to you? Because I reached out through email. I'm not sure if you have a
Yeah,
recollection, and I guess the communication stopped because I wanted to, like I
absolutely.
stated in my email, to
Yeah,
get
let
back.
me give you my calendar, right?
Sure.
I get texts, WhatsApp, emails to three different emails. Sometimes I get myself lost in the different time zone.
Sure.
Uh, it kind of makes things a little bit complicated. But let me give you here my website, and there is a calendar there, and all you got to do is book one of the minutes that are available in the calendar, and then I'll
Okay.
see you there. This is much easier on me. So this is
Sure.
the website here, www.npexamcoach.com. If you move down on the main page, there is a calendar. Once you book the calendar, makes it things a lot easier for me because I do have 4 different emails, tons of social medias, all the social medias, WhatsApp, message. So it gets a little bit overwhelming. But if you get on my calendar, I will receive a note and it makes things a little bit easier for me. So go ahead, book a time with me in my calendar. And
Mhm.
then if the time is available, I'll be available to you.
Sure.
Okay. All right. Thank you.
Thank you.
Uh, Jovit Leroy, you raised your hand. What are your questions today? How can
Well,
I help you?
yes, I just to add to Michael question.
Yes,
Uh,
please.
so as far as the cage and seabird, um, from what I know is seabird is more in detail.
Mm-hmm.
Then when you have those two, the best choice should be the CBER because the CBER give you more detail and you can able to identify if the patient or the client is more trouble than just the cage because the cage is only limited to just the alcohol alone.
Yeah, they also have the cage, modified cage, but it still would be the same, that can be used for drugs.
Okay.
But it's still very, very simple, and that is another thing that you need to know is that the cage, what's the benefit of cage, whether it's the modified version for drugs or the cage for alcohol. It's a simple tool that can be done in 2 minutes, right? On
No.
a fly, but it's not in detail. It just, or either you're positive or you're negative, either for drugs or alcohol. Okay.
Okay.
But yes, thank you for adding to that. That's a very important comments that you made. Thank you.
Thank you.
Terry Jackson, Mrs. Jackson, how may I help you
Oh,
today?
hi. Good
Oh,
evening, Mr. Lopez.
hi.
Hi, nice to meet you in person.
I know. I've been talking to you on Facebook and I haven't seen you here, so I'm glad that you're here today.
Yes, I'm glad I was able to make it. I have a question, and this is
Sure.
related to Lori Calloway's question about
Okay.
um the ticks. So,
Yes.
so I was wondering because actually Lori and myself are working on the questions together, and I was wondering if it had something to do with the frequency, like how we prescribe, if we're going to give clonidine based on the frequency of the ticks, or
Hmm.
because one of the questions said mild ticks, and then the answer was
Exactly. Exactly. So that's why I developed the second question on top of that. They
okay,
might say myotics. They might say that the kid improved from a X that doesn't exist, a grade X to a A, just to give you the dimension. The kid now is on time, doing great, achieved his best life ever. So it makes it sound that we don't need to do anything.
okay,
Okay. So the question will not be that detailed or will not be that mean to say that the person went from an F to A, and they'll say something like, in all aspect of his life has been improved since he started on a stimulant. He's now getting A's, being on time, and no longer lose um, his keys, his pencils, or whatever, right? So it sounds really good. But the premise here that you need to understand is that if you have someone on a stimulant and they develop tics, your goal is to stop the medication immediately. Even though the mother, the teacher, and everybody else says hey, this kid improved so much, right? Because the tics, it may be mild now, but it will intensify by the use of dopamine. That it's the premise of a stimulant, right? So lots of dopamine there. So in that case, you stop the medication and you switch to either clonidine, guanfacine, or straterol.
Okay, what if, because the scenario didn't have ADHD involved in the question, it basically, the first question asked, what if a person, and I don't remember it like verbatim, but it asked something to the point of a patient had mild tics, which medication would you give? And then it had everything in it, including clonidine, but no guanfacine. And then the next question asks frequent tics, but it had no ADHD in there, and it had guanfacine in there and not clonidine.
So either one is fine. There
Okay.
is no better. There is no better choice. Is
So they
either
won't
one?
have both in together is what I'm trying to get at. They
Say
won't
again?
have clonidine and guanfacine in together. Is what
Correct.
that's
Correct.
that's how they're trying to trick us. That's where
Yes.
it's at.
Yes.
Okay.
They're trying to understand what your action with tics and which medication to give if you know both of them, right?
Okay. Got
So I mean, we make tests and we know, like, I make tests, professional tests, and I submit questions. I know exactly what what differentiates between knowing the content and sort of knowing the content, because a lot of us sort of know, oh, if I see it, I'll know, but that's the incorrect answer.
Okay.
You know the content when you can cheat with a closed eye. You can get out of bed, get in front of people and cheat, then you know the content. But
Thank you,
sort
Mr.
of know, yeah.
Thank you so
Absolutely.
much. That was really helpful.
Yes, any questions, you can always reach me out. If you're not in our course, reach out on the Facebook page or something. Obviously, if you are in the course, you have the WhatsApp communication that we talk every day there. But yes, don't let your, most important thing, don't let your questions be unanswered. We're here to help you guys, regardless whether you're in a course or not.
Okay.
All right, Mrs. Brown, go ahead, please.
Hello, Dr. Lopez.
Hello there.
To open that 4 hour thing. So I was a little bit off today because I could not get into it.
Say it again.
That 4 hour thing that we have discussed that you're
Oh,
going to
yes.
send to me.
So I sent you an email and you
You
could
did,
not
but it didn't open. No.
Oh, okay. Yeah, so I was late night, 11 o'clock, and I just wouldn't want to wait for the thing to upload. But as soon as this course finished, I already got the videos. I will shrink it, have to shrink it, and then upload to the XP site,
Okay.
so that you guys have it. Yeah, I figure you would be able to see it from the email that I sent you.
No, I wasn't able to. So I shoot you out
Oh.
a message, but I guess you didn't get it yet.
Okay, so I'll go ahead and put it today. Sorry about
All right,
that.
thank you so much.
Okay. Jovit, Leroy, do you have another question there?
I do.
Please.
It's about the client association thought, like a circumstantial, but I
Yes.
don't understand the client association. Would you mind explain that, please?
Yes. So first of all, when they would say clang association, so it's a speech pattern, right?
Yeah.
So where words are chosen based on how they sound rather than their meaning. So let me see. I cannot even make an example, but so this involves like the limit, like the sounds of the words. If they sound together, they go together. So words with similar sounds, but they can also include alteration or sound alike words. So that's a words of that's clang association. So for example, if I say like I like bikes, hikes, and I like strike, they don't mean anything, but they all sound alike. So
Okay.
that is words of association, right?
Okay.
So people with schizophrenia, bipolar disorder may develop clang association, especially during manic and psychotic episodes. So it's considered a symptoms of thought disorder and can disrupt communication. So now the question, since you brought that up, is where would that be annotated at?
It will be in the thought process.
Correct. Correct. So I want to hop on something a little bit more because too often I see students make the same exactly mistake for something that's so easy. Suicidal ideation, hallucination, auditory confusion. Where would I annotate this on my assessment?
Thought content.
Contents.
Content. Okay. Please, 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 if you do not know this, make a note because it's likely to be in your test. This is a very well-known question. This probably was in your test in your school, right? So you need to know this in detail because that's the easy hanging fruits. Those are, we cannot afford to miss. That's easy points. Okay. All right. Jackson, please. You have a question there?
Oh, I just wanted to say I remember the thought content part by crazy content.
Okay, that helps. Crazy content. Okay. Just be careful not to mix them because they can clang association can be a crazy content too. But
No, but we're talking about hallucinations,
ooh,
delusions.
okay, I like it. The more detailed, the more vivid you make your description, the more it gets to your brain. The crazier it is, the better it is that you never forget. So thank you for that. Do we have someone else that had raised a hand, or that's it?
I know Michael posted some question in the chat over here. Would you mind? Yeah.
Yes. So yes, please let me know because sometimes I'm not following the chat. Let me read it here. What's the question? So in chat, the gold standard for autism, I would say so. Yes, a neurotransmitter involved in nightmare. Oh my, you asking the same question again, but I already answered the question. I'm gonna answer again. Nightmare is not norepinephrine. All right,
It's serotonin.
serotonin.
Okay, that's
I
what
know
we hear.
I know you kind of asking the same question again, but I'm glad that you are now because if it comes up to be in your test, pick serotonin. Okay, so nightmare is serotonin. It's not serotonin has a lot to do with the fight or flight syndrome there. So it's serotonin. Okay,
Okay.
so let's clarify a little bit because it sounds like that is norepinephrine. If you don't know the content, you'd pick norepinephrine. I probably would pick norepinephrine too because if it sounds like. But why then is serotonin? So while serotonin plays a role in the sleepy mood regulation, right? Is directly involved in nightmare and is more complex than a simple correlation. So it's true that serotonin is involved in regulation, relationships between serotonin and nightmare is not necessarily straightforward, but several other neurotransmitters could also be involved. But when it comes to nightmare, it's serotonin, not norepinephrine, right? So serotonin is also involved. Nightmare can be complex, right? So it is influenced by interplay of various neurotransmitters rather than attributing just serotonin. But which one is mostly attributed? Just like I would say that schizophrenia. Oh, dopamine, increased dopamine. Sure, but there are other things going on. There is glutamate, there is norepinephrine, and there is other things going on. But which one is the most for schizophrenia? You say dopamine, right? So the same thing with nightmare. It's not only serotonin, but which one is mostly involved is serotonin. Okay.
Thank you.
Does it answer your question?
Yes, I finally get it. Because I was
Okay,
being
write
too
that
inactive.
down because that's a tricky one. That's probably one of the 5 most tricky questions because it sure sounds like norepinephrine, because it's nightmare, right? But there is more to it. serotonin is involved with nightmare more than dopamine or norepinephrine. Okay, that was the question that you asked as well, right? Did I answer the other question? Okay, MCHAT, yes. So MCHAT for gold standard. You also need to know what the letters for MCHAT or other scales are involved, because what happened is that during the test, they will not spell it out MCHAT for you. They'll just put in the letters, because if they did, it likely would answer the question. However, when it comes to medication, they'll give you the brand name and the generic name. So you don't have to memorize for medication both names, but it would be helpful if you know the acronym for the scales, you know, what MCHAT stands for and so forth, because they are likely to just give you the acronym and not the whole description. All right. So we're about to get started, unless someone has another question. Let me just well, a few things first here. Let me see here. Okay. I don't want to instigate anything, but I just want to clarify this, and please don't take me this the wrong way. Someone just recently, a few minutes ago and yesterday, was very mad that she didn't pass the board. And I know my students, right? I know everyone by their first name, and I know exactly what they are. And it's just like, I didn't pass my board. I did your questions. And it's like, okay, I don't see you in my course. Okay. Oh, okay. I just want to, this is not to instigate anyone, and I apologize if this feels wrong. But she's like, I didn't pass my board. And I said, are you in our course? And she said, no. And then I became more confused. I was like, okay, you are complaining that you didn't pass your board, but you're not in our course. Yeah, and she's like, well, I've been doing the Facebook questions and watching your videos there. And I became more confused every time, because I'm like, this is not the course, guys. This is not the course. If you are only doing the free version, if you are only answering few questions and watching few videos that we post, this is not even 10% of the course, right? So if you are doing that, it's great. It's better than nothing, but this is not enough, okay? And then I asked, and then I didn't want to ask who she took the course with, but she went ahead and told me this morning that I took with Georgette. And I said, go ahead and ask your money back. You didn't pass, right? And go ahead, send her an email. Maybe she'll do a one-to-one with you. Guess what? I'm not throwing anybody under the bus, but this won't happen. You know, unless if you are in my course, I promise you, or either you pass or I'll give you your money back. I promise you, if you need special attention, I'll give you as much as I possibly can. So, you know, don't expect to pass only with the free content that's pasted on that we give on the Facebook. And I don't mean to discourage you in any ways. That's good stuff. That's free. But the course is so much more than what we give on the Facebook, right? It's fair. I cannot divide my attention between 1,000 students when we have people that are entirely dedicated to our course. Those are the ones that I devote my attention. I have to, right? And I'm glad to do so. But if you are confused between what you're getting on YouTube or what you're getting on the Facebook, and you think this is enough to claim your pass, this is wrong. That would be a wrong and a deadly mistake. And if you took Georgette, great, go ahead and take it. I'm by all means. But half of our students took Georgette and did not pass. I have to warn you that. And a lot of people get mad when I say this, but it's so true. So true. So if you are ready for less than the expensive dinner for two, you can get this course and settle your future. So it makes me a bit of anxious talking about it, because what we offer is so much more, and it's so inexpensive compared to the time, knowledge, and everything that we offer. You know, we offer the modules 1 through 5, the PMHNP crash course review, the diagnose test 1, the diagnose test 2, the question bank, the live course, the daily follow-ups that we do through a WhatsApp group. So someone's going to sell you this in 6 different courses, right? But we sell it in one, and very less than an expensive dinner for 2 and a night out with fun. You can get this course. So I cannot even say what else to do, right? I mean, and the person is really mad, and I'm like, you're talking to the wrong person. You didn't take my course. I don't know how to answer your questions, because you went with the crowd, you decided to go that way, you did that way. Now you need to talk to the person there and find out what went wrong. But I was just dumbfounded by the rationale that some people think that, oh, I'm doing the free questions on Facebook and I am guaranteed to pass. That's not it. That's not even close to being enough. It's good. It's free. Go ahead, take it. But it's not, my commitment is not on that. Okay, I just want to clarify that. So Donna here said I took both. Georgette and Scratch does this, only scratch the surface. What you have. Your course will prepare you for the boards and practice. Absolutely, right? We don't teach only for the board. We teach you primarily for the board, but we add a lot of day-to-day practice, because passing the board is only the beginning. You do not want to pass the board if you're not ready. I promise you that. You don't want to get sued. Okay, so we take this very, very seriously. We take it so seriously that once you pass the board, we'll still give you as many or as much possible time to ensure that you're successful on your practice. We'll follow up with you on your patient care. Why do we do that? We don't have to, right? That's a lot of time and commitment, but we build the community, and that's the goal, right? And it's so cheap. The course is so cheap that my hour is $500 an hour. That's what I charge, $500 an hour. And I sell for the course for like a fraction. If you put the time that I give it to the individuals, they might just come back to $5 an hour. So I don't know what to say. But if I see somebody I charge $500 an hour, oh, somebody else do it for $150. Say, good, go there. I hope you get your treatment that you're paying for. But mine is $500 an hour, and I don't, that's my time for the patient care. So, but in my course, it may boils down to $5 an hour, and we're trying to build something bigger and better, whether you believe it or not. So it's your choice. And I just want to take this out of my chest and kind of put a word out there, because we provide a lot of free content. We have 3 employees that are paid only to provide copy and paste my content and post it online and do interactions and answer questions, because I don't have the time to do that. So all my money that we make on the course, I have to pay the employees to do things like that. But this is about a community, really is. So, and see, someone said here, I think because it is not stimulants, patients are typically was on the conservative when it comes to medicating their child. I think this refers to the previous question about stimulants and what you should do. Okay. Oh, someone said, thank you for sharing. It's obvious that you are trying to give back to the community and build your business. Absolutely. It's both, right? So I could be retired by now. I have I don't want to go in my personal stuff, right? I do it because I love to. I could right now do nothing and still be good in my life. I have served the country in many ways. I have been to wars, right? Which I wish on nobody, more than once, twice or 3 times or 4 times. I have spent more than 5 years in a war environment, right? I could just do nothing, say I'm not doing a thing anymore, and I want to just kick back and relax for the rest of my life. And that's totally possible because I achieved that goal, right? So why do I keep going? Why do I keep reach the next level? Because I love it. As simple as that. I mean, the first thing that when I wake up, my routine is like this: is thank God for what I have, for my roof, for the food, for my family. And then after that, I reach to my WhatsApp and I see who passed today, right? And that will set the tone for my week. That will absolutely set, because I thrive on people's success. So if you say, oh, so you were selfish. So maybe I am, right? I love to see people succeed. That's what I get my drive every single morning, right? When I don't have the person pass that week, I know I'm starting to get worried, right? So who's going to text next? Who's going to test next, right? So I really love to see people succeed, asking questions. And about 1/3 of my time is devoted for the people that already passed. They're having this complicated patient, so we kind of do a little meeting online. I cannot do a 4 hours meet, but I can always spare 30 minutes to talk to you and about this patient and that patient. Do I have to? No, I don't have to. I mean, you pass the board, my commitment should be done, but it's way beyond the board, right? The board is just the first step. But anyways, just want to take that out of my chest, a little rant here. I don't want you to make, the point is, I don't want you to make the same mistake as this person that didn't pass the board, took Georgette. She should complain to her, but she's upset, I guess, with me because you answered the questions on the Facebook. This is not enough. This is the board. This is your life. This is the most important test of your life. Because if you don't pass, what you going to do, right? So please, if you raise your hand, Seashell, go ahead.
Yeah, I asked if there was Kahoot today, and then she replied saying that, well, just playing games isn't enough, isn't it? And then she said that she's not in the course and all that nonsense.
Oh, okay. So you saw that. So yes, I'm glad you see that and you were able to back up my story here. But it's, I get it. So I have to get to her level where she's at now, right? So it would be unuseful to tell her straight away, like, hey, look, you didn't prepare with me. What can I say? We need, as providers, as people that work with mental health, we have to meet them where they at. And sometimes that means backing off. That means, hey, tell me how you prepare for your test. Rather than say, look, I don't know what to tell you. I mean, you didn't take the test with me. So I don't, what do you expect of me? So I kind of have to back off and be like, how did you prepare? Oh, I took Georgette and I took the LMR and that didn't help me. So therefore your course will not help me, right? I said, okay, so let's backtrack a little bit and see, how we can improve your situation. But the person is so mad that she didn't pass that she not even want to talk to anybody. So I don't want that to be you. I want to see you pass and succeed. Whatever you have to do, to whether you want to take her course, Georgette course, by all means, go and take it. If you feel like this is a better fit for you, please go ahead, join our course. Or if you just want to get the free stuff, that's fine too. That's not a problem. So, she's very displaced with anger, right? But it was just very difficult for me because I'm like, what did I do? You're not in my course. I know everyone by their first name. So this is how much interaction that I have with everyone. Some people just choose to come to our course and do their thing on their own, and that's fine. But those that choose to interact and talk to me, I'm available. I think I am an approachable person. So, but anyways, off the topic, let's get started with today event. Again, my goal was for you that are not enrolled not to make the same assumption that just the Facebook will be enough. That's not enough. Okay, it's great, it's free, yes, but not enough by any means. Okay, so let's get started.
Dr. Lopez,
So
I'm sorry.
if you have not, yes.
What is the
Go ahead,
game
please.
pin today? The game pin, I'm sorry.
Yeah, it's fine, man. It's Kahoot. Have you played Kahoot before?
Yes. Just I would like to get the pin for today's. Game pin.
Yes, I don't have it either.
643-051.
Thank
Correct.
you.
That's the PIN number.
Thank you so much.
Absolutely. So
You're welcome.
anytime. So if you have not played Kahoot, the first time can be intimidating and a bit difficult. So if you have not played, please let me know so I can walk you through the steps.
I'm good. Thank you. Thank you for
Right.
your guidance.
Have not. Absolutely. So it's best if you have your phone and your computer. On your phone, you go to www.kahoot.it, not .com. Okay, Kahoot.it. And then it will ask you for your nickname. You can put your own name, or you can put it PIN number, and the PIN number is 643-051.
Okay. Thank you.
643, absolutely, 051.
It's 463-051.
Oh, I'm sorry. No, 643-051.
Thank you.
Yes. So I'm gonna get a glass of water and then I'll be right back. And if you haven't been able to log in, please let me know. Don't be like, oh, I'll do it next time. Oh, I'll just watch. Just like the videos, our course is not meant to be watched. It's meant to be participating. When you engage, you learn a lot more than just watching. I know it takes a little bit more of you, but please participate, write it down the information. It will pay you dividends. Okay? Let me get a glass of water. I'll be right back. We get started with our Kahoot game. All right. So at this time, is anyone not able to log in and is having trouble? Please speak or text. Okay. So it seems like everyone is ready. Kahoot, you answer on your phone. You answer on your phone. Okay. Jackson, Mrs. Jackson, could you please speak up there?
Just one more minute,
Unmute.
sir.
Okay, no worries. So Kahoot, you answer the question on your phone and you look on the screen for the question. Okay, on the computer screen that you are now on Google Meet, you look on the screen, but you answer on your phone. Once you answer, it'll put your input in the question automatically. So you have to use your phone in order to do that. Now, being fast is important. Just like the test, you should not take 1 minute and 20 seconds. In fact, here, we only give you 1 minute. Why? This is important because once you take the test, it's not about answering few questions, not about the question bank, it's about endurance. 175 questions can be very, very painful. Okay? In fact, we have a PMHNP diagnostic test. If you think you're ready and you score more than 80 in our test, I promise you that you will pass the real test. That's a sure way, 99% chance of you passing. If you don't, I tell you to go ahead and reschedule until we get there, okay? So we're about to get started. Jackson, are you good?
Yes, Dr. Lopez.
All right, so we're about to get started, guys. Being fast and being correct is the goal. Let's get started. All right, we have 20 seconds left. Pick your best answer. Wow, good job, guys. So proud of you. So anytime you have a question that you can see a distress before the symptoms, then most likely that is a adjustment disorder, okay? Because there will not be depression. And you need to differentiate between adjustment disorder versus major depressive disorder versus anxiety disorder. So if you see there was a stress here, significant distress and symptoms following a recent life stressor, right away, this is an adjustment disorder. Then you need to find out whether this is which type or subtype of adjustment disorder that is. All right, we have 30 seconds left. Pick your best answer. Okay, you guys are getting it. Okay, so you're getting the point here. We're driving the same question in different ways, right? So here it is a adjustment disorder with disturbance of conduct. So there was something that happened before the patient started acting that way. Okay, so remember, adjustment disorder, you will usually have a symptoms there. Terry. Okay, so I try to make it the writing a little bit larger, so I'll try to increase the font next time. Okay, next question. See if you can see better if I increase it now. Look on your computer screen. All right, 15 answers so far. All right. So the same question in different ways, guys. So we had 3 repeated questions in the same format, just a different subtype, right? So do we have a distress before the event? Yes. So now we have to figure out what kind of symptoms. If the symptoms is I can't walk, I can't see, I'm having seizures, right? So there will not be adjustment disorder. Anyone unmute your mic and tell me what kind of disorder would that be?
Conversion disorder.
Conversion disorder.
Yeah,
Conversion disorder, right?
Yes.
Now, if the symptom is anxiety, stress, depression, misconduct, then there will be adjustment disorder. Please, these are easy. I'm putting the same question in different ways so that way it helps you click. Okay? So, but no conversion disorder. If you have, my mother died last month and now I am blind. That's not an adjustment disorder. That's a conversion disorder. Okay? I can't walk. I'm having seizures. And the questions usually will come with the patient has been cleared by neurology. That's another cue. Okay? Good job, everyone. Keep up. Most of you guys are getting. If you're not, make sure that you get it today. All right. That's another distinguish. You need to know this for your test. Okay? Between two of the conditions here. Very close.
I mispunched, doctor.
All right. All right. It
Me
happened.
too. Me too.
It happened to the best of
It's
us.
too close. My finger
Okay.
is too
I know
close.
you know this answer.
Yeah, me too. I mispunched.
Okay. No worries. That's the cost for being fast. So it happens. Okay, so as I imagine, someone would take PTSD, right? This is not PTSD. This is an acute stress disorder. Acute stress disorder is less than 1 month.
Oh,
However, 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 if the person had PTSD as a diagnosis before, your answer is PTSD. Pay attention. This question gets so many people. As in a veteran had been to war several times, he has a diagnosis of PTSD. Now he had a car accident in the last 3 weeks. That's a red flag. Basically, it's trying to pull you towards acute stress disorder when the answer is PTSD. Okay, so just like major depressive disorder and bipolar, if one has coming to you off feeling depressed but has a history of bipolar, your diagnosis is not major depressive disorder, is bipolar. So same thing with PTSD. Okay, let's see if you will make a mistake. I have a similar question and I hope that everyone gets it correct. And if you don't understand, stop me before next question so I can better explain. We have 10 seconds. All right. Very proud of you guys. Everyone, mostly everyone got it correct. So good job. This is clear PTSD, right? Avoidance, flashback, persistence for more than a month after the trauma, PTSD. Symptoms like PTSD, less than a month, acute stress disorder. However, if the patient has a history of PTSD, will always be PTSD, never acute stress disorder. All right, we have 10 seconds left. Good job, everyone. PTSD means EMDR means SSRIs. That's like a medication, mean therapy and medication of a choice. EMDR, SSRIs would be the medication choice. Oh, which SSRIs? It really doesn't matter. Few of them are FDA approved for PTSD, like Prozac, like Zoloft, and I believe Paxil as well. I could have to double check, but I believe Paxil as well, right? So these are medications that are approved for PTSD. If you see a question about PTSD and asks about the therapy of choice, EMDR. Now, you need to know the phase of EMDR as well. All right, so we have someone with PTSD and nightmare. Which of the following medications would you give to help with the symptoms? We have about 10 seconds left. Pick your best answer. Okay, guys, so if the medication, it's about nightmare. Nightmare is prozocin, right? So that is a medication for high blood pressure, but it works very, very well for those patients with nightmares and PTSD. Okay, remember, nightmare is serotonin, not norepinephrine. We have 20 seconds left. Pick your best answer. All right, 100%. Good job, everyone. OCD is the answer. And who is on the lead here? Lori Calloway is taking the lead. And she said, I'm not letting go. So let's go for the next question here. Thirty seconds left. Okay. Most of you guys got it right. Maybe somebody keyed in incorrectly, but this is a clear case of Tourette's. To be Tourette's, it has to be more than 1 year with symptoms, okay? However, the question may or may not give you that information. But if you need to distinguish between provisional motor or vocal tics, then it has to be less than a year. Tourette's more than a year. and the modal and the vocal tic. All right, so here we have more than one neurotransmitter involved. But which one would be the most involved with the motor symptoms of Tourette's? If the question on your task asks about Tourette's, that's dopamine, serotonin, or norepinephrine. Which one's mostly involved? All right, so that would be excessive dopamine, right? Just like schizophrenia. Right? But I want you to write it down: dopamine, norepinephrine, and serotonin. And then once you put it under there, Tourette's, ADHD, major depressive disorder. So now you have 3 conditions under one bucket. Another one: alcohol, substance abuse, things like that, dopamine and GABA. Dopamine, dope, and GABA, okay, for substance use disorder. These are important ones. Another one, schizophrenia, dopamine and glutamate. Mostly dopamine, but glutamate has a high impact as well. Mostly if it shows up in your test would be dopamine. Okay? Anxiety, right? So it would be lack of GABA. Okay, we have about 10 seconds left. Pick your best answer. All right, okay. So let's take a look on the rationale. This is a clear case of schizophrenia and why it is a schizophrenia, right? So the patient's symptoms of disorganized thinking, hallucination, withdrawal over a prolonged period of time, it said over the last year, aligned with schizophrenia. So schizophrenia is characterized by these symptoms that last for at least 6 months, right? At least 6 months. The question may not give you that detailed, but if it says since last year for a while, the question is most likely the diagnosis. This is an important question as well, guys. So what age do we see a breakthrough of schizophrenia? I would go by on that. I would define the ages for male and female. These are important information you need to know for your board. We have 10 seconds left. Pick your best answer.
Male is 18 to 25.
Perfect. So absolutely right. I would go above that. So let's see who's in the lead. HJ is taking the lead. So I want you to write this down. Schizophrenia. Age of 18 to 25 equals male. Females 25 to 35, these are the breakthrough schizophrenia. In fact, I only see breakthrough patients in my population. I don't have ever seen a chronic unless if they started with me, but because I only see this population of 18 to 35, so I only see breakthrough of schizophrenia. Very, very common. Never had any issues before. All of a sudden you see some predominant symptoms, and all of a sudden you see full-blown schizophrenia. Okay? All right, this one, everyone should get it right. I want to see 100% correct on this question. Okay. We have 20 seconds left. All right, 100%. So there's nothing for me to say here. You are all correct. Good job, everyone. Next question. Same question, different way, right? All right, we have 25 answers, 26 now, 20 seconds left. Same question, just a different way of asking. Five seconds left. All right, so I hope that someone miskeyed the information, right? Because it was the same questions as the previous questions. If you answered the previous question correctly, right, you should have answered this one correct as well. So you need to know in detail the difference between negative and positive symptoms of schizophrenia so that you are better prepared for your board examination. So how are we going to treat someone with schizophrenia and functional disorganization, impairment? This is a hard question, right? Sort of. All right, we have 15 seconds left. Pick your best answer. Okay, so you guys are killing it. Someone has a schizophrenia and it's not doing so well. We need some medications, right? But we also need therapy, right? So we need medication therapy. Medication is good. Medication therapy is better. Now, you should know which form of therapy is most appropriate for schizophrenia. We might see a question like that in a second. We talked about this in the previous question. Hopefully everyone get correct. By the way, you need to know your dopamine pathway really, really, really well, okay? Otherwise, you will get confused when they start mixing them up. Okay, guys, well done. Good job, everyone there. It is an overactivity of dopamine that causes the positive symptoms in schizophrenia. That's known to be one of the neurotransmitter involved with schizophrenia. Glutamate is another one, but mainly dopamine. Did I answer this question? I think I might have. Huh? Let's see who's paying attention. So the purpose of these questions are to drive the point, right? Drive a point. So it's the same question asked in different way. If you are able to answer one correctly, you should be able to answer the next question that's related to the topic. Okay, so you guys are killing it. I just said that glutamate and dopamine is related to schizophrenia. Okay, so you should know the dopamine pathways like in the palm of your hands, because you will get a question on that, right? And that should not be a hard question because it's about memorization. Most consistent linked to schizophrenia. Same question, slightly different way of asking, right? Which of the following structure, brain structure abnormality is mostly consistent to schizophrenia? In schizophrenia, should I say. We have 15 seconds left. Pick your best answer. Hey, well done, guys. Well done. So HJ, she's taking the lead there, right? So yes, absolutely. You'd see a lateral ventral increase, lateral ventral increase. All the other structures really in the brain of someone with schizophrenia would be decreased. So what's important? Increase in the lateral ventricles, okay? All right, so this question was asked yesterday in our group chat, on our WhatsApp group chat. If you are part of our review, you should know this answer very, very easily. Okay, well done, guys. So in my pre-test, I put in a kind of tricky question. I said hip to waist ratio, right? So the correct terminology is waist to hip ratio. Waist to hip ration. And that is the first sign. You need to write this down because the question may come with BMI and waist to hip ratio and ask you what is or which one of the following is the first sign that you may see of metabolic syndrome. Waist to hip ratio. Very, very important. Write that down. This is an important question. You should know this answer. We have 30 seconds left. Pick your best answer. Ten seconds. Okay, so if the question asks, if you have a stable patient, schizophrenic or bipolar, on a, whether it's mood stabilizer or SGA, you do not change the medication if the concern is a metabolic syndrome. What you need to do is address the condition with diet and exercise, okay? Or low calorie and encourage daily exercise. Do not change your medication regimen if someone is stable. At least first, the first action. Later, you may have to. All right, 5 seconds, pick your best answer. Okay, well done, guys. Most of you guys got it correct. Well done. So in the settings with one schizophrenia, you may want to group therapy as the best choice, okay? So we're looking for someone, a therapy that's non-pharmacological interventions to support the patient in the community, okay? There is a certain therapy or program that's ideal for the patients that have medication non-compliance.
Non-compliance.
Okay, well done, guys. You guys are killing it, right? So same questions in different ways to make sure that you get it correct on your test day, okay? All right, you guys are fast. Good job, everyone. Pick your best answer. We have about 25 seconds left. Okay, very good. Let me complicate things a little bit. If the answer choice was lithium, would you pick that? Anyone unmute
No.
yourself?
No.
Say again?
No, because it's for bipolar.
Because it's, yeah.
No, because it's a schizophrenia case, right?
Yes.
Okay, perfect. Do not fall for that, right? Lithium would be one of the choice. Maybe a question comes up like this because they want to make sure that you are referring to schizophrenia. Do not pick lithium. You want to pick clozapine, okay? But lithium also has been shown to decrease suicidality. In which condition that is a true statement? Anyone?
Bipolar.
Bipolar.
Okay, so if the question's about bipolar, go with lithium. If the question's about schizophrenia, go with clozapine.
Closer rail.
Make sure you don't get those easy points confused, okay? Make sure you're doing the PMHNP diagnosis test too. That's 175 questions, 3.5 hours. You scoring an 80 or more, go ahead and test it. Go ahead and test it, you will succeed. Okay, so we have 30 seconds left. Okay, well done. Well done, everybody. So, Abilify, Geodon, Latura, Sinopine, these are like the most, I call them the skinny meds, right? So those are very well appropriate for those that are concerned with weight gain, okay? Now, I want you to write this down too. If we're talking about SGA or second generation antipsychotic, if we're talking about atypical medication, which is the same thing as an SGA, what makes them different than the first generation or typical antipsychotic? Someone give me the answer.
The
5H,
serotonin.
5H2.
Okay, so great.
5H2.
5H2, great. There is one more thing, but usually it's not in the test. It's a partial agonistic, but let's not get in
Doctor
detail.
is, I'm sorry, Mr. Doctor, is 5HP2 or 2A?
Can someone answer that question?
5HT2A.
2A, right? Yes.
Perfect. Okay, let's not get confused. Now, I want you to understand this. Because it's a second generation, because it is atypical medication, you are less likely to get what?
Overdose.
Neuroleptic Malender syndrome.
EPS.
APS, right?
EPS.
Okay.
No.
Extrapyramidal side effects,
Yeah.
right? So atypical, less likely to get that. Now, atypical is more likely to get what?
Metabolic.
Perfect.
Yeah,
Perfect. So they are more likely when compared to typical or first generation to get metabolic syndrome. The first sign of metabolic syndrome is what?
Weight gain.
Waist
Okay,
to
Wait,
Weight
to
hip.
hip,
ratio.
waist to
wait,
hip,
hip.
so your hip circumference. So make sure you understand the difference. Make sure that atypical is more likely to get metabolic syndrome than typicals. Okay, so you don't get those easy questions confused. Okay, we have about 10 seconds left. Pick your best answer. Okay, so when it comes to mood stabilizer, the least weight gaining medication is lamotrigine. Okay, so that's lamotrigine. That's your preferred answer for mood stabilizer. Least sedation, right? Hard question, right? Well, not that hard, I guess. All right, very good, guys. I thought it would be a hard question, but no. All right, Abilify, least sedation. Good job, everyone. Damn, I thought it was going to be a hard question. You guys are killing it. Good job. PMHNP, by the way, there. Okay, well done, right? So if the question comes to be about which medication has the least drug-to-drug interaction, let's say a patient is on cancer, patient has cancer and is taking medication for that condition, which of the following medication is the least likely to provide as drug-to-drug interaction? Pick an SSRI. If there is two SSRIs, pick Lexapro.
Mm-hmm.
All right, 2 seconds. All right, so lamotrigine is the correct answer. Good job there, everyone. So lamotrigine, right, is generally considered safer compared to lithium valproic acid. Now, in the same manner that I said that the Lexapro was the least drug-to-drug interaction, Targadol is the most drug-to-drug interaction, or one of the most. It kind of interacts with everything, really.
Tramadol?
Yes.
Dr. Lopez, would you repeat that again?
I'll do the next question here. Okay, good job, everyone. You guys are killing it, right? So, same questions from the beginning. I just asked in a different way. So I said that drugs that has least drug-to-drug interaction, Lexapro, especially among the SSRIs. A drug that I'm very concerned particularly is carbamazepine, because carbamazepine has a high drug-to-drug interaction. Okay, you should know what are the FDA approved warnings for carbamazepine, right? And you should know that it causes birth defect, and you should know which population not to prescribe to. So,
Thank you.
absolutely. We'll go over your questions. Let me just finish the game here. Okay, so very good, right? Schizophrenia, the patient's symptoms of paranoid and delusional deterioration in functioning is consistent with schizophrenia. The presence of bizarre behaviors and severe symptoms over a extended period support this diagnosis. So, guys, this is just a tip of the of the iceberg. When you are in our course, you get so much more. So here we had Jeanette. Good job, Jeanette. I know you've been taking the lead in several of the previous game. Lori, you did super well, and HJ took the lead. I did not see who was the fourth or fifth place, but I am super proud of you guys for joining in today. Keep doing it, guys. Whatever you are doing, if it's working, keep doing it. Don't give up. Study every day. You will succeed on your PMHNP board certification. If you need extra help, we are here in P Exam Coach. If you don't need the extra help, that's fine. I wish you absolutely the best luck. Okay, so I am going to stop here the Kahoot, and then we'll continue with our meeting on our Google Meet. So,
Doctor,
go ahead.
I'm sorry to interrupt you before we jump in off, and this is going to be my last question. Is acamprosate, is
Okay.
safety is safety in the liver?
So let me think about that. A composite. Geez, I'm mixing up. I think a composite is safe in the liver, while Jesus, I'm blanking out now. While naltrexone is safety for kidney. Okay, so
Yes.
they have an inverse relationship. So I always have to look that up, but I'm pretty sure is when I have an alcoholic patient, I want to dictate whether I want to go with a composite or naltrexone. I look at the labs, right? So a composite, I believe, is for the liver. If they are liver compromised, then I would go with that. If they are kidney compromised, I would go with naltrexone. I have to double check, but I'm pretty sure that's the answer there. Alrighty. Any other questions specifically for the test that I can help you with, or even questions about your own experience that you would like to go over?
Dr. Lopez, I thought lorazepam and liver.
Okay, so but that's different, right? That's different. That was not related to the question. Well, it is related, but it's a different question. So we're talking about two different types of medications. We're talking about alcohol withdrawal versus
Which is
lorazepam.
yes.
For alcohol withdrawal, acute symptoms. We're not going to give them neither a composite or neither naltrexone. We'll give them lorazepam or
Any other of that?
Value.
Valium. Okay, naltrexone. Then we decide, is the liver compromised? Yes, lorazepam. If it's not, Valium. Okay, same thing for alcohol use disorder, not in acute phase, not in the withdrawal phase. Naltrexone, a composite, and
Anti-abuse.
anti-abuse. Anti-abuse. How many hours before you prescribe the patient
12
needs
hours.
12 hours
hours.
before? How many days after the patient needs not to
2
have
weeks.
2 weeks.
2 weeks, right? Okay, that question about whether it's good for the liver or the kidney most likely will not be on your test. There'll be a real life question, right? Then you look whether you prescribe naltrexone or a composite. You look at the lab values and you look at the liver. If the liver is compromised, you can give naltrexone. I mean, if the liver compromised, you give a composite.
Composite.
If the kidney is compromised, you give naltrexone.
Naltrexone.
Okay, so that's real life. It's unlikely to be on your board test. That's like more in depth than you need to know. But the alcohol withdrawal is severe, is critical, most likely to be on your test. Okay, not to say that the previous question they can't. It's just that more than what you need to know. So they are worried whether if you encounter a situation, can you prevent a situation from getting worse? It's just like you work in a ER. You can miss GERD, you can miss a whatever, but you cannot afford to miss a cardiac attack, right? You cannot just look at the AKG and say, oh, I think this is GERD, right? And there's not. But you can miss GERD, it'll be okay. Your primary care will catch, right? But you cannot miss a MI. So the same thing is for the board. There are some things that you cannot miss, because if you do, it will be very, very serious. For example, pregnancy test. If you is prescribing a mood stabilizer or an SGA, and your first action, it could be a pregnancy test. That's important, right? It could cause irreversible harm. So those things that we cannot afford to miss. We can probably miss whether this is a anxiety or major depressive disorder, because that will not kill the patient. And the medication most of the time is the same anyways, right? We can miss those things, but we cannot miss very important details that are definitely put the patient at harm. Okay, Jennifer, you have a question there?
Dr. Lopez, I have a question. I can't access my quiz bank still. You said you're gonna send me a password, but I can't access.
Okay, can you put your email on a chat box? So we'll go over it just a second. We'll go over your stuff in a second, make sure that you have it. Okay.
Yeah, 1 minute.
Dr. Lopez, I came across something really interesting.
Okay, please.
Antidepressant associated with dose-related cardiovascular adverse effects, requiring that the prescriber stay under a 40 milligram max.
Say it again, one more time.
Antidepressant associated with dose-related cardiovascular adverse effects,
Okay.
which requires his prescriber to adhere to recommended dosing unless the benefits outweigh the risk.
Absolutely.
Effects, sir.
Yeah.
Effects, sir.
So hold on. We are mixing them up. That's a good question. Cardiac complications, SSRI. What options do I have? I have 6 options, right? So we have to stay with SSRIs. And the option that I would not pick because it has a risk for cardiac is
TCA.
one at a time. Go ahead.
TCA.
Okay. No, but let me rephrase it so I don't. That's right. But are we talking about SSRIs?
Celexa.
Celexa, citalopram,
Correct.
right? So what Celexa and the Lexapro, they are very similar, but the Lexapro is missing a substance in their chemical composition that does not affect the heart as much as citalopram. Okay. So very good. Did I answer your question?
Oh, I knew the answer. I just wanted to mention it.
Okay, very nice. Thank you for that, for sure. All right, so what are the questions there?
Okay, Dr. Lopez.
Yes.
Okay, I don't know what's going on with the question bank. I can't access it. It just give me.
Okay.
You need to
So
go do 10 questions.
We'll stay here live, and then we'll go over your account once we stop recording. Okay. So I just want to go over here that acamprosate is primarily excreted by the kidney. Okay. So, however, this is not as important, it's not metabolized by the body and is excreted unchanged in the urine. So if the patient has a kidney condition, right, it could be important. Okay. So I just want to place a note here that someone mentioned that acamprosate is excreted by the kidney. Says that again. Say that again. So I just want to confirm. So the important is to know that acamprosate is not metabolized by the body. It is excreted uncharged by the urine. So again, it's the same principle. So if you, where's my phone? My daughter kidnapped my phone, so I can't look.
All the
I have to unmute you guys here because otherwise someone is have a hot mic there. Okay, so the question is that then you should, if it's a composite, right? If it's if the liver is compromised, to go with a composite because it has less impact on the liver. If the kidney is compromised, you go with a naltrexone. Okay. So what we'll do is that we'll take like a 5 minutes break. We have lots of questions, so we can answer everyone's questions and go over all the details about the course, go over all any other concerns right here live today. So I'll stop recording for now. So that way we don't have all this in the recording. We'll take a 5 minutes break and then we'll continue with questions and concerns.